a new project between Vietnam and the United Nations Population Fund, UNFPA, entitled Support the Ministry of Health to Effectively Address Inequalities in Sexual and Reproductive Health and Family Planning, and deliver health support to emerging issues to developing and monitoring the implementation of evidence and human right-based laws and policies for the period 2017-2021, was launched recently between the Ministry of Health and UNFPA in Vietnam. With a total budget of $6.4 million for 4 years from 2017 to 2021, of which $5.5 million is funded by UNFPA. The project focuses on increasing universal access to and use of quality services, helping people make their own choices about their sexual and reproductive health, as well as effectively responding to urgent issues such as sex ratio at birth imbalance and gender-based violence for all groups, especially disadvantaged, vulnerable people, and promoting gender equality in Vietnam. Ladies and gentlemen, welcome to Sharing Vietnam on VTC Thai Net Viet. Despite a lot of advancement, the health system in Vietnam, especially those of sexual reproductive health services, still face a lot of challenges. And to tackle these issues, we welcome the representative of UNFPA in Vietnam to talk about the upcoming cooperation between UNFPA and the Ministry of Health during the period of 2017-2021. What will they do in order to develop and monitor evidence-based policies to support the health system? Thank you, Ms. Astrid Bant, so much for joining our program today. Could you please briefly share with us the current sexual and reproductive health status of Vietnam?
We have high contraceptive use in Vietnam, so it's around 80%, and that's very high if you look at it worldwide, because that makes pregnancies more wanted and safer, and people can space better, so that all that is good. On the other hand, we brought maternal mortality down, but if you look at the internal differences between maternal mortality, we know that maternal mortality among ethnic minorities is 3 to 4 times higher than in the rest of the population. So that's a really big gap that shows that there's something going on with the services in those areas. Around 40% of ethnic minority people have home births, and that is only 6% among King population. So that's a huge difference that we should be working on, because having babies in a medical establishment is much safer. 30% among youth say that they don't feel comfortable with the type of information, quality, and access to services.
The upcoming partnership between UNFPA and the Ministry of Health will address the emerging issues of Vietnam. Could you please share with us more in detail regarding these issues?
One issue that I have already discussed sometimes with you is the issue of cervical cancer, and we have really made some progress with Ministry of Health to start working on that, and we are looking at the best way to introduce the HPV vaccine that can prevent cervical cancer among women. And today I would like to also mention another type of emerging issue, which is the issue of the unnaturally high rate of C-sections, cesarean sections. Normally, let's say, in the world, 10 to 15% of babies need to be brought into the world by C-section, because the proportion of the mother's cervix and the size of the head doesn't allow for a natural birth. And there's some other issues that really need C-section. But in Vietnam, around 40% of women have C-sections, and that's not necessary. It's an unwise spending of resources, and it might also bring health consequences. So I think we have to look at the root causes of this, and do more awareness raising, know more about this, and try to tackle the high amount of C-sections in Vietnam to bring it back to a normal rate.
Thanh Hóa is a big province after Ho Chi Minh City and Hanoi, with a population of 3.5 million people. The number of women in childbearing age and pregnant women is also very high, about 615,000 people in childbearing age and more than 70,000 pregnant women, with over 55,000 newborns each year. Therefore, pregnancy and neonatal care and management is a heavy task. However, in recent years, Thanh Hóa, together with Hòa Bình, An Giang, Điện Biên, are the 4 leading provinces in the whole country when implementing comprehensively the program of health monitoring book for mothers, children, the Mặt Trời Bé Thơ program for neonatal intensive care, and training program for skilled village midwives. Despite achieving such results, Thanh Hóa still have 7 districts categorized as poor districts of the country, where access to reproductive health of people, especially among ethnic minorities, is very limited.
Ở những vùng này thì tỷ lệ suy dưỡng trẻ em còn rất cao, tỷ lệ về quản lý thai nghén đang thấp và cái tai biến sản khoa còn cao, và các cái chăm sóc sức khỏe sinh sản, đặc biệt là sàng lọc ung thư cổ tử cung, ung thư vú và sàng lọc các cái bệnh tật viêm nhiễm đường sinh sản và các bệnh lây đường tình dục khả năng rất hạn chế, cùng với cái sự thiếu hụt về các cái trang thiết bị ở tuyến xã sau nhiều năm không được cung cấp. Và trong 3-4 năm gần đây thì chương trình mục tiêu quốc gia giảm tới hơn 65%, do đó các cái nguồn lực thì bị hạn chế. Chúng tôi cũng rất kỳ vọng cái dự án do UNFPA tài trợ giai đoạn 2017-2021 này sẽ hỗ trợ cho Thanh Hóa về đào tạo, cung cấp và nâng cao năng lực của cán bộ y tế, truyền thông vận động và tạo lập những môi trường chính sách tốt, cùng với là hỗ trợ về kinh phí, tài liệu và các cái phương tiện hỗ trợ khác để có thể dần dần làm giảm cái sự khác biệt giữa các vùng núi, vùng sâu, vùng xa, và tăng cường cái truyền thông, giáo dục, thay đổi hành vi về chăm sóc sức khỏe sinh sản và sức khỏe tình dục cũng như kế hoạch gia đình.
UNFPA is committed to supporting the government of Vietnam in achieving the vision of universal access to quality sexual and reproductive health package in all communes and districts. At the same time, apply a unified and multidisciplinary approach when addressing issues related to health care. What should the Vietnamese government do in the period 2017-2020 to address the unfinished agenda to reduce the gaps between different population groups and regions?
Now we got to a point where what we have to do more is going to be more difficult, and progress will be slower because we have to do the last mile, and it's people that are hard to reach, and to reach people that are difficult to reach is more expensive and needs a lot of attention and sustained attention. Make sure that national guidelines are actually applied in provinces. Make sure that we make good use of resources in society like community organizations and health workers. They know the area, they have the trust of the population, and they can apply culturally sensitive services, and they speak the language, and that's an issue. A lot of issues arise from contraceptive failure, so people don't know how to use it, discontinuation, which is people go back to the health post and then don't find the type of contraceptives that they used to take in because it run out. So there's issues around how people experience the service, if they're treated well, if their privacy is honored, respected.
We learned that in the news cycle, as well as you have mentioned many times before, UNFPA will support the prevention of cervical cancer in Vietnam. Could you please share with us your recommendation for the country to reduce the mortality due to this disease?
Because we also know that cervical cancer is more prevalent in women that start having sexual relations early and that have many children or more children earlier. So then we already are looking at certain populations that also have economic conditions that won't allow for them to buy these vaccines. So I think that might be a differential approach. For a large part of the population, it should be free or almost free. And then for another part of the population, it could be obtained in another way. What we would like to see is that it's somehow included into the universal health insurance package. It is an investment now, but in the long run, this investment will come back to the government because they won't have to treat so many women and lose so many women. We already have a lot of information from other countries and also some of Vietnam, so we can show that there's a cost benefit to this. We have to make people aware that cervical cancer is an issue and it can be prevented, and make sure that people will actually look for this vaccine and support the government when it comes to the point to trying it out in certain provinces. And I think we have to work through the schooling system with parents and students in order to roll this out eventually. And we're trying to broker between private enterprise, Gavi, which is a worldwide platform that tries to bring vaccines for a reasonable price to countries that need it, and the government, so that hopefully by 2020 this will be a reality for all young women, that they will have access to this vaccine.
Could you please share with us some of the example of other countries that also apply the HPV vaccines into the general vaccinations package?
I think Thailand is such a country, and also South Africa. So in South Africa, I worked in South Africa a couple of years ago. At some point, all girls between 9 and 11 were vaccinated. I could mention one other thing is that technology improves so quickly, you know. So some years ago, we needed 3 doses for people to be immune to HPV, and now only 2, and that might possibly be reduced even more later on. So this is a really positive development.
Thank you, Ms. Astrid Bant, so much for all your sharing today, and I hope the best for the upcoming partnership between UNFPA and the Ministry of Health. So that's the end of our program today. Hopefully you have gained some interesting information regarding how we can protect our sexual and reproductive health. For any questions and feedback, please email to shrangvietnam@netvittv.net. Thank you and see you again.